Okay, thank you. Good evening and welcome everyone to an alumni panel as part of the Navigating the Healthcare Admissions interview portion of today. This is our third and final event of the day. This morning we did have a presentation about how to prepare for health professional school interviews in general, as well as the three major types of questions you might encounter and strategies for responding to those, as well as a first alumni panel where we heard some really fantastic, insightful examples and advice for our current cycle applicants. So we're thrilled to have our second panel now, and thank you everyone for joining us. If you do need to grab some food right now, it's dinner time, that's perfectly fine. This is fairly informal. And so we are recording this currently too. It will go up on our website so people can check the slides after. In addition, anyone tuning in, you're welcome to drop your questions in the chat box, please. Just make sure you address them to everyone because we will have time for audience Q&A at the end. All right. And with that, I'm going to just share a couple slides. Erin, in the meantime, would you like to introduce yourself and say a few words as well?
Sure. Good evening, everybody. My name is Erin Samboli. I am the Director of Pre-Professional Advising at UConn. So I get to work with all of our advisors many of them are here tonight. I want to thank you for giving your time to our current applicants tonight and want to celebrate those of you who are on the screen who are about to matriculate. I know a couple of you were just talking about that. So this is our opportunity to say congratulations officially if you haven't already heard it. We're so excited to hear from you.
Thank you so much. So Erin joined the team in May of last year, so you might not have met her yet. And she hasn't actually been to the physical office yet, so we like to tease her about that a lot. All right, so here's the plan for tonight. We're going to begin with some really brief intros, then the warm-up questions, and then audience Q&A. In addition, you did not realize this, but by agreeing to join this panel, you have tacitly agreed to our pet policy. So please note that if a pet or a small child, I suppose, enters the screen behind you, you must pause, introduce that pet or child, and then, share a few fun things about them. All right. So let's begin with some staff intros. I do want to give a shout out to Lisa, who led our presentation portion this morning. She is a career consultant with the CCD, and her contact info is at the end of this presentation as well. So she's a great resource. She works with plenty of pre-health professional students over there as well. In terms of our office, we have had some exciting staffing updates recently, so I do want to let those advisors tuning in right now have a chance to introduce themselves to everyone. So I believe going alphabetically is Emma here? I'm not sure if she's here right now. Okay. Heather, please.
Yeah, hello, my name is Heather Nunes, and I'm a new pre-med advisor to the team. I've been here for about a month, so sat in on some coaching sessions and will be working with alumni engagement as well.
Paris, is Paris here?
Yes. Hi, I'm Paris Pruitt. I joined the team in April. Definitely glad to be here, but was a pre-med student myself at UConn, so I definitely understand this journey. So it's great to be here.
Awesome, thank you. I'm Krista Rogers. I'm also an advisor in the office. And Dr. Sanford.
Great to see everybody. Happy for all of you. It's great to hear your stories. We work with sort of hoping to complete stories. So it's glad to connect with you again. Thanks for doing this.
I know for some of you, it's been just a couple weeks. Others, it's been a few years. So it's just such a delight to see you here today. And Tanya, we do want to give a shout out to you, please.
Hi, everybody. I'm Tanya. I do a lot of emailing and behind the scenes scheduling. And I also run the Instagram, which I have a lot of fun with. So it's great to see some familiar faces here tonight.
She was also the class of 2020 commencement speaker a couple months ago, so you might recognize her from that. Okay, and then also a special thanks to Dr. Caroline McGuire, who is the Executive Director of Enrichment Programs and Director of the Office of Undergraduate Research, who has been very supportive and instrumental in our processes. And with that, I'm going to ask our panelists to now introduce themselves just really briefly, name, affiliation, maybe something you're doing this summer, and at risk of starting an inter-alumni war, perhaps your favorite dairy bar flavor.
All right, I'll start us off then. Hi everybody, my name's Adrian. I'm happy to be here. I'll start off with my favorite dairy bar ice cream flavor. It's actually banana chocolate chip, really good. Yeah, so I'm from Connecticut. I grew up in Connecticut, and then I went to UConn. I graduated in 2017, and I actually took a few gap years. I took 3. And I ultimately ended up applying to MD PhD programs and matriculated during COVID actually in 2020. And I decided to go to Harvard and MIT, a combined program between the two.
Hi everyone, my name is Sandy. So I'm currently in Arizona ATSU SOMA, and I'm doing a deal program. My favorite dairy bar, I actually only went to dairy bar once, and I think I had the Rocky Road, which was pretty good. Let's see. Yep, and you know, I graduated undergrad in 2013, and I worked a little bit. I also did graduate school and the postdoc. So yeah, that's my journey.
Hi everybody, my name is Catherine. I graduated UConn in 2017. I majored in bio and English. My favorite dairy bar flavor was probably chocolate, very basic, but it was right next to the lab where I worked, so I went there a lot. In between med school and college, I took a gap year and worked in Mexico for a year through a Fulbright. And I just finished my 3rd year at Cornell, and I'm going to be taking a gap year. So my program will be 5 years.
Hey everyone, my name is Michael. I actually just graduated this past May. I was a bio major and MCB minor. I'd say my favorite flavor would probably be blueberry cheesecake. And then I'm starting UConn Dental this coming August, so definitely excited about that.
Hi, I'm Shauna. I graduated from UConn in 2019, and I was a molecular cell biology major. I wanted to include some UConn photos in here. I did take a gap year, and I was an AmeriCorps member during that year in East Hartford at a federally qualified health center. I really enjoyed that, and I'm currently in my 2nd year of medical school at UNECOM in Maine. For my favorite ice cream flavor, I'll have to agree with Adrian on this one. I do like the banana one. I try to get a new flavor every time I get ice cream somewhere, and I had never tried banana, but it was good. I think that's it that I have to say.
Hi everyone, my name is Roslyn. Favorite dairy bar flavor would probably be the raspberry sorbet because it's dairy free and I'm lactose intolerant. I just graduated in May from UConn, physiology neurobiology major with a WIGS minor. And now sorry, I've got flies in my house. And this August I'll be enrolling at a Yale School of Medicine.
Rosalind, I see some special enthusiasm from your friend in the office. All right, thank you so much. And what I love about this panel is everyone's bringing such diverse things to the table. You've all had such diverse experiences, but UConn is kind of the one thing that does connect all of you in some form. And with that, so I'm going to ask now let's focus on the warm-up questions. This is going to be hard, but if you're able to limit your answers to about 3 minutes each, just to make sure that we keep moving. And I'll ask you to combine number 1 and 2 in your initial response, please. So number 1, just share a bit about your pre-medical journey and most meaningful experiences at UConn. And number 2, what was your interviewing experience like as a whole? So if we could, maybe I'll just take a volunteer who wants to kick things off.
I don't mind trying to get us started here.
Thank you.
So my pre-medical journey was a bit delayed, I suppose. I did take 3 gap years. I thought that I might want to apply to medical school at some point. So early on during my time at UConn, I met with Dr. Sanford, got a sense of what classes I should, check off and do to make sure I can still apply. But then I sort of let it linger for quite a while. My interest really was in research, and that actually ended up being my most meaningful experience at UConn. And so I sort of kept that momentum, and I worked as a research technician for 3 years before applying. And so, it was a bit of sort of back and forth between wanting to do pre-med and research, and I needed some extra time to sort it out. In terms of my interview experience as a whole, um, I I only applied to schools in the Northeast, and so I remember interview time as kind of a lot of traveling, a lot of trains, a lot of meeting new people. I really enjoyed meeting other applicants, and those were kind of the experiences that I remember the best. Not really sitting in the interview room, more, learning about the campus, learning about the schools, because interviewing just as much as you're evaluating schools. And I think that that's kind of the aspect that I remember the most. And I think that programs are actually really keen to show you certain things about their school, and trying to recruit at the same time that they're interviewing. So a lot of good food. I remember that sort of stuff, thinking back on it. And I think altogether it was actually a really pleasant experience.
Thanks, Adrian. I just want to bring up someone this morning also mentioned that this is not just the school's chance to interview you, but your chance to interview the school to make sure you're a good fit, or they're a good fit for you. I mean, all right, second volunteer.
I can go. Yeah, okay. So I guess for my pre-medical journey, it's a lot similar to Adrian's. I took more than a couple years off. I think it turned out to be about 8 or 9 years. So this will be geared more towards the post-bac students. I finished my post-bac in 2020, and I applied right away. And I guess for my most meaningful experience on UConn's campus, I think our trip to Italy with Atlantis for me was the most meaningful. And then also now I'm finding out, because I've had 2.5 weeks of classes under my belt taking A&P, with, I think it was 74, 75. So with Dr. Tanner and Dr. Chen, not necessarily the most meaningful, but as of right now, the most useful, just because I still remember a lot of the things, and we're relearning anatomy, and I'm not in that process because they're so fresh in my mind. And what else? Oh, and you said anything. Oh, so for the interview, so I interviewed in 2020. So this was at the height of the pandemic. Everything was online. So I had one interview that was pre-recorded of videos of questions, and I had to record myself answering them. And the other one it was still video, but it was, with actually a human being speaking to me on the other side. I think what I missed is that I couldn't go onto the campus and visit. I couldn't have a feel for, the area where the school was and everything. Obviously, there's a lot of website tours, guided tours of all pictures and everything. And some pictures are worth 1,000 words. However, if you're gonna have a online interview cycle, it's gonna be tough for you to get a in-person feel. But overall, I mean, I think, people were very understanding. If, my internet dropped and I froze for a second, they'll stop, they'll give you a chance to catch up, or, you can email admissions right away and be like, hey, I forgot the login or something like that, and they'll work with you for that. So yeah.
Thanks, Sandy. I can go next because listening to Sandy's experience, I had interviews pre-COVID, so they were in person, and it sounds totally different. And I give you guys so much props for doing it during the COVID times. For me, my pre-med journey, I was always debating between PA school and pre-med school and medical school, and ultimately I obviously decided picking medical school. So if any of you have questions about that, feel free to reach out to me after. But I think through doing research, through my classes, Mary Bruno's biochem class, I wonder if that's still a thing. I decided that med school was the right fit for me. And I think interviewing overall was interviewing in person is a really great experience, and hopefully more schools are doing it this year for you guys. I do know that Cornell is going to do virtual interviews this year for their medical class. So in case any of you are applying here, but it's a lot of fun. It's a lot of pressure, and I think it's easy to feel stressed. But like Krista said, think about it. It's your one chance to interact with a school, the current students, and it's a really great way for you to get a feel for what kind of school you want to end up going to. I think that every school has a very different vibe, and talking to as many people as you can on your interview day, as many current students as you can in general, is a good way of getting that vibe of the school. And having said that, though, I think also if your interview day goes poorly, don't be discouraged. I don't think that you won't get in. I got into programs that I thought the interviews went really well, and I didn't get into programs where I thought the interview went well, and I got into programs where I thought the interview day went really poorly. So it's just do the best that you can, and then the results will come out after that.
I can go next. So I kind of always knew I wanted to go to medical school since the beginning of my college career. It was just a matter of finding out what field within medicine really drove me the most. And I tried to seek as many like diverse experiences as I could during college. I was a Spanish translator for the Migrant Farm Workers Clinic, which was really important to me. Probably one of the most important experiences, just getting to talk to all the migrant farm workers and learn more about like the health disparities within the population. And the other thing that kind of really drove me was my work with the LGBTQ plus population at UConn. I also worked at the Rainbow Center throughout my whole college career, and I helped run the medically and legally trans workshops there, and getting to speak with trans students about their healthcare experiences and stuff like that also really impacted me. So just kind of things like that made me realize that I wanted to focus my medical career on working with primarily like an LGBTQ plus population and an Hispanic population. And kind of like my interview experience, which is actually still pretty fresh. I feel like I actually had a generally positive interview experience, even though it was virtual. And I definitely did miss the in-person aspect of it, but I feel like a lot of my interviews felt very conversational. It didn't feel like they were grilling me super hard or trying to trip me up or ask trick questions. Like I felt like they were just genuinely trying to get to know me as a person, which I really appreciated. And I got to have lots of interesting conversations. I think it was very scary going in because you have this preconceived idea of what interviews are supposed to be like, but then coming out of it, I was like, oh, okay, that wasn't so bad.
I could go. So I also always knew that I wanted to go into medicine, like some other people here. And when I was at UConn, some of my most meaningful experiences was doing research. I did both wet lab research and I did clinical research in the URAP program with Dr. Smith. One of the projects that I did at UConn was on primary cilium in my wet lab, and it's such a niche topic, but at UNECOM, there's two different professors who do all of their research on the primary cilium. So I was able to connect with them, and I ended up continuing that research in the summer in one of the labs here. So that is meaningful if you're interested in research. A lot of medical students will do research during the summers or during the year, and that's a great way to gain experience as an undergrad, to have skills when you're in medical school. So I had applied to a lot of osteopathic medical schools. So the interview experience when you're interviewing at an osteopathic medical school is going to have a focus on OMM, or osteopathic manipulative medicine. So some of the conversations in your interview will be, why do you want to practice as a DO? Why do you want to incorporate OMM into your ability to practice? They want to know that you have an understanding of it. So that's just something that is a focus when you're applying to DO programs.
So I guess I'm the last one. So going into college, I pretty much knew that I wanted to go into the dental field, and then it was pretty much with like being a part of the pre-dental society that gave me like a lot of experiences and further strengthened that passion that I had. I'd say the most meaningful experience at UConn was being a part of the public health house learning community, because that definitely showed how important it was to like give back to the community, and it also allowed me to make friends that I'll have for a lifetime. Um, Overall, with the interview experience, kind of going off like with what Sandy said about how, because mine was also virtual because I had it last year, it was kind of hard to get like a full picture of how the school would be since you couldn't really interact with students or tour the area. But overall, the interviewers, they made the whole process, I guess, as easy as they could. They were pretty casual and made it about kind of like giving you the chance to put yourself out there and shared whatever you could. And that I guess something different than the medical interviews, they ask you like what you do with your hands, kind of the whole manual dexterity question. So that's something to keep in mind.
Thank you so much, everyone. I do want to just mention that our presentation from this morning, the slides will include links to compile lists of the school policies for interviews this coming cycle. Some schools are still figuring this out right now. Others have decided they are going to be fully virtual. Some will be in person, some will be hybrid. So I did drop a link to a document that's updated pretty regularly as one of these resources, but make sure you do check out the slides because there's more information, for example, about the four core tenets of osteopathic medicine. In fact, a recording that Shana and her sister did for a different series we did back in February with more great advice and that kind of thing. All right, and now, if you will, in the same order, please, just respond to questions number 3 and 4. And so we did talk this morning and give some examples about different types of traditional, behavioral, and case type questions you might get. So we're very curious to hear your examples of interview questions that you especially enjoyed, and then maybe a question that was really difficult or unexpected for you to answer. And then finally, just your kind of overall tips for our current cycle applicants to best prepare for their interviews. So Adrian, please take it away.
Yeah, sure. So I don't know if this is a cop out or not, Krista, but my favorite question that I'm again not sure where in the organizational schema it falls, but my favorite was always tell me about yourself in the very beginning because it's not always a formal question. Sometimes it's casually if you're both walking into the room together, something like, but nobody knows you better than you. And it's some people find it easy to talk about themselves. Some people find it hard to talk about themselves. I think that it, as you rehearse and as you do more interviews, you realize that you have almost a narrative that you've made of yourself, and you stay true to it, and it's quick, it's easy, it's a quick one to answer, and it sort of starts the tone. And I was always very confident in answering it because, like I said, there's no wrong answer. You know yourself better than anybody. Um, Challenging question. So there's one in particular that I found challenging, and the reason why is because I had my answer to this question, but the advice I was given was to answer it differently. And so that question was, so I was applying for MD PhD programs, and the question was, if you had to choose one, the MD or the PhD, which would it be, and why? And for me, the answer was a PhD, and I had my reasons. But the advice that I received was you should say you can't choose and that's why you're doing an MD PhD. And if they ask you, are you sure if you had to, you really have to choose. You just maintain, I can't choose and this is the reason why. And so I had received that advice from a couple of different people, current students, medical students, current MD, PhD students, some of the pre-med advisors here at Harvard College too. And I couldn't come to, maybe I'm stubborn, I'm not sure. I just couldn't come to answer it the way that they wanted me to. And so I answered it honestly, PhD for these reasons. And so I always had this dissonance, right, when answering that question between what I felt was genuine and what I thought might be the strategic answer. And so my solution was to go with the genuine answer. How do you recommend preparing for interviews? So what I did was I sort of listed out the questions that I would expect. I started by writing answers in, like as paragraphs or, bullet notes. First as paragraphs, and then when I got a little bit tired, as bullet notes. And I found that was good for consolidating my thoughts, but I never really used the notes as a resource. Later on, I would sort of rehearse speaking them aloud to myself, and that was sort of, I guess, the next phase after writing them down. But part of an interview is conversational, and so I mean the entire interview is conversational, and the questions are sort of decorated onto that. So you can prepare and rehearse these answers, and if you do them as you've rehearsed them, you can. I felt like it was like I would hear myself and I would sound scripted. It wouldn't be conversational, and so a huge part for me for preparing for interviews was just like mock interviews, just having a conversation with somebody while you're trying to convey answers to these questions and show who you are as a person and as an applicant. So I think the mock interviews are really good. And frankly, I actually think by the end of it, I got much better than I was at the earlier interviews. And I honestly saw them also as a practice. And so, kind of keep throughout the cycle, my mindset was to learn from all of those experiences and, just get more comfortable with the conversational aspect as well as, say what you've practiced at the same time.
Okay, so I guess I'll go next. Yeah, so I agree with pretty much of everything Adrian said previously. I'm not gonna try to repeat what he said. I'm just, anything that's different, I'm gonna add. So my favorite question was towards the end. One interviewer asked me what I would do if I got into multiple schools. And that caught me off guard. I actually started laughing. I was like, that would be the dream. So essentially, that was one of the questions that caught me off guard. It was really nice for me to answer. I said something along the lines of I would choose based on, like the closest to where my support system was. The hardest question for me was actually not a question. It was like, and it happened with ATSU, and I signed a non-disclosure form, so I can't tell you the question, but essentially my interviewer asked me a question and I answered, and then he asked again, so I didn't answer the question, right? And so he kind of said, hey, like you haven't answered the question, so like let's start, can you tell me more? Can you give me details and examples? And that might happen. Don't let it trip you up. Interviewers know that this is a stressful time for you and they're going to help you out as much as they can as well. So that was a very nice thing for them to do, or for my interviewer to do. Another thing that happened during my interviews is that there was actually one of my interviewers who was connected to UConn. So we actually had a conversation about how he took a sabbatical and went to UConn and taught A&P. And, I told him actually, like, one of my recommendation letters is from that professor. And like, we talked about that. So that was a great way to connect. So definitely it's a lot of a conversation. In terms of tips, so I used, before each of the interviews that I had, I booked Lisa, I booked like a 30-minute like interview help with her, and that was very easy to do. She went through with me everything that I wanted to cover, so to speak, and also I gave her kind of like things that I was feeling unsure of, like how do I convey this or how do I convey that, and she helped me break it down, write myself like a list or bullet points and stuff like that. I practiced either in my head or with a parent or someone like that. The other thing is I didn't necessarily write out paragraphs. I wrote bullet points just because I didn't want to end up reading from that material. And similar to Adrian, I had it in my hand, like I had my journal, but I never actually ended up needing to open it because you know yourself best. So they just, you just want to tell your story, and essentially you would work on telling your story and communicating your story the best way you know how. And then finally, I took some time to look through the competencies and also the mission statement and the vision statement of the schools, just because a lot of the times they're going to ask you, why us? And you have to know, right? You have to tell them, this is why I think you're awesome and I want to go there, So definitely know that for sure. But yeah, that's it for me.
Like Sandy said, I'll just try to emphasize new things that haven't been brought up already. I think the one I enjoyed the most was a very conversational one. Interviews are very different. I had ones where we just would talk about books and like the city that the med school was in the entire time. Like no, it didn't feel like an interview at all, and those were always really pleasant. For a difficult question, I think that one of the most important questions you may be asked on your interviews is, why do you want to go to medical school? Why do you want to be a physician? And you need to know how to defend that answer against any other field in medicine, compared to being a PA or a nurse or a dietitian or all the different roles in healthcare that you can take. Especially for me, having an English background, I did a lot of work with like Rosalind, the Migrant Farm Workers Clinic, Spanish. So having a kind of anthropological background, I got asked on one of my interviews, I got grilled at why I didn't want to become an English professor or an anthropologist. And you just need to have an answer for that. And you need to be able to explain why you want to be a physician compared to being a physical therapist or an English teacher. You have to know. I think for overall tips, Adrian mentioned the word narrative, and I think that's a really good way to think about it. I came up with 5 things for each of my 5 fingers that I wanted each of my interviewers to know before I left the room. And that's going to look different for all of you. For me, those things were like my family, my English background, my work with Spanish, my research, and I forget the last one now. But all of you have a combination of 5 things that make you unique, that make your narrative, your story to how you got to this interview for medical school. And that was really helpful for me, because sometimes we would talk about, through these things, but at the very end, when your interview goes, is there anything else you'd like to tell me? I'd be like, yes, I have these 2 parts of my story that we haven't talked about. Can I quickly talk to you about them? And that way I would leave each interview feeling like I've done everything I can. They know everything they need to know to make their decision. The second thing I would say is reread your application before every single interview. I know this sounds crazy because you guys are doing your secondaries and just finished your primaries, and you're like, how could I not know every single word, every single period that is in my application? But when you interview, especially later in the season, January, February, if you get any interviews around that time, it seems very far away, and you just always want to know what's in your application. Remind yourself of what you said, because interviewers will expect you to know everything that you put on paper. And then finally, this will only apply if you have in-person interviews, but make sure you have comfortable shoes, especially if you choose to wear heels. I was interviewing while I was living in Mexico, and I only had 1 pair of heels with me, and they were the most uncomfortable pair of heels ever, and I had to wear them to every single interview. So just save your feet the trouble and get a really comfortable pair of shoes.
I can go. So I do have to agree with Adrian for the question that I liked the most was, tell me about yourself. But interestingly, for me, it was a question that was asked at the end of an interview. So at that point, I had felt like I had said everything about myself that I could. And then they asked me that question. I was like, what else is there to say? But I realized that they had never asked me one of the most important questions, in my opinion, which is, why do you want to go into medicine? So I kind of changed the question to explain that. And I think that's really important. And through my explanation, I was really able to connect with my interviewer because they had a very similar view to mine. For a question that was difficult, I was asked if medicine didn't exist as a field, what would you go into? So that was very difficult for me to answer because I hadn't ever thought about that. I was prepared for like a question that was like, if you weren't to go to medical school this year, what would you do? And I was prepared to say, oh, I would go next year or something, but I never expected to have a question that it wouldn't exist. So you had to have a different answer. And how do I recommend for current applicants to prepare? What I did is I would actually reach out to a school that I would interview at and ask if I could get connected with a student who is currently there, so that they would be able to talk to me more about the school. And I think that you can get a lot more information from a person than you can from a website sometimes. And during an interview, they will ask, why do you want to go to our school? And so that is a great way to be prepared for that question. Also, just knowing your application really well, because sometimes they can have your application right in front of them during the interview. So they will pick out things and you have to be prepared to talk about it. And specifically because I go to an osteopathic medical school, for being prepared for those types of interviews at a DO program, being able to explain your experiences with osteopathic medicine, and if you have shadowed a DO, those are important points to bring up.
I can go next.
Yes. Oh, sorry.
Sorry. You can go if you want. I don't know
Oh,
I don't know. It's hard to see on the screen, but
it's okay. You can go.
okay. Um, so I think in terms of questions I really enjoyed answering were probably all the ones that were really specific about my application. Like you could tell when someone had really read into your application because they would ask like I had one interviewer ask me specific questions about working on the migrant farm workers clinic and what I thought about certain issues, and I really enjoyed having those conversations. In terms of a question that was difficult, I feel like everybody always gets like that one question that really throws you off that you like wouldn't have even thought someone would ask you. And for me, it was, who's the person that you're closest to, and how could you possibly become even closer to them? And like I just didn't really know what they wanted from that answer, like what they were trying to get from that answer. So I kind of just got stuck on the spot. I didn't but I think I answered by saying my mom, and I came up with something. And I think what they were really just trying to gather with those questions, or any kind of question that really throws you off, are like what your core values are, and also how quickly you can think on the spot. But you know, it's hard to prepare for every question they'll throw at you, but it's okay to take a minute and just think, and even say like, can I just think about that for a few seconds? Like they really don't mind. And just like take your time and answer the question instead of just rushing through the question. In terms of recommendations, I got some really great advice from my old boss at the Rainbow Center, and it's what I've used for any interview I've done, whether it was medical school or any other sort of program I've interviewed for. They basically told me that instead of like, you can like think of all the questions you might get answered, but it could be like an infinite number of questions you could possibly be asked. So they told me instead to kind of just pick out the key moments in your life and the key moments that really define you, and kind of write down a list of anecdotes about yourself. And they don't have to be anecdotes that will answer a specific question, but like just a few key anecdotes about yourself and your activities that will kind of fit into multiple questions that you can kind of tailor. And so I use that advice they gave me. And then I also looked at all the core competencies that like the AAMC lists, and I try to think of an anecdote that kind of fit into every or a few of those competencies. And I kind of had these list of anecdotes that were just running through my mind. And I felt like when I was like armed with these anecdotes, I could answer any question that they threw at me. And that was really helpful. Like I always like would read through those anecdotes right before going into the interview. So I knew like what I knew my story and I knew what I wanted to say.
So I guess a question I enjoyed answering, I guess against popular opinion, was like why dentistry? So I thought this was my favorite question because it was basically the whole reason I was applying, and everything was outlined from writing my personal statement. So it was good to have that to think about and draft my answer during the interview. An unexpected question, not really difficult, but for an interview I had for Florida school, they were asking if the interview was in person and you had to fly here, who would you choose to sit with on a plane? Like either living or dead. So I thought that was just kind of like a weird question. And it was like right at the end, so I was kind of just thrown off. Um, and then just general advice, kind of going off of what everyone said, just making sure you know your application like inside and out, because you never know if they just have it right there and then they catch you for something that you said, like either if it was just a mistake or not. And then in my personal experience, I use Student Doctor Network a lot just to get like question types and see what other applicants from the past use to answer, and then just to get an overall feel of the school in general.
That was so interesting hearing all of your examples. Definitely some curveballs there that no one would have expected. So thank you for sharing. Next, I just want to show this slide very briefly. So this is Lisa's contact information and our office contact information. So you can make a quick note of it. This is also the MCAT Doggo of Success, so you can pet the doggo for some good luck. And I'm just going to close out of these slides now. We do invite anyone in the audience to drop some questions in the chat for everyone, or just feel free to speak up and ask the question directly to our panelists and or a specific panelist. Panelists, you do not need to answer every question, so don't feel pressure, and we're just going to take volunteers from here on out. All right. Would anyone like to kick it off with a question?
I'd just like to ask the group to talk about any student interviews that they had.
Yeah, I can start with that. I think my only student interview on the trail was actually at UConn, and it was a great experience. We just really clicked, had a lot in common. I think with student interviews, one of the benefits is that, they're just probably a year or two older than you. You feel very comfortable. But also talked, before that student interview, I talked to another one of my friends who was interviewed for med school, and some advice he gave me was, if you are interviewing with a student, it's okay to feel more casual, but also remember that you are still interviewing with a student. He told me some horror stories about students who would, start swearing in front of him, like punch him in the shoulder to try to gain camaraderie. Basically just being too casual, and you should still remember that it's a professional interview. They represent the school just as much as if a physician was interviewing you or someone on the admissions committee was interviewing you. So just be aware of that. I don't think any of you would start swearing in front of a student interviewer, but it is nice because it's a very comfortable interview. I do think to that, one of the things that I found very interesting on the interview trail is that so many different types of people interview you. You can have students, you can have physicians. I had a surgeon who literally came straight out of surgery to his office to interview me. I interviewed with a PhD, although I was only applying to MD programs. MD, PhDs, admissions committees. So you can really interact with a lot of different people at the school.
I believe Dr. Sanford actually has some stories about interviewees swearing during their interviews. So that is a big no-no. Just don't do it. Anyone else before we move on want to share any experience speaking with student interviewers?
I don't know if this will be the same for everybody has a different interview experience, but I noticed that all of the schools I interviewed at, I was interviewed by a student, and I noticed that the student interviewers were the ones who had more closely read my application. So from them, I got more application focused questions that really dove into my activities. I did feel like I had to be a little like I also felt like the student interviewers were a little bit more structured at times than the faculty interviewers. I think one of them even told them like these questions are going to feel a little bit more structured or scenario based, but it'll be okay. And I don't know if again that's just the school I interviewed at or if that will be at other schools, but that's just something I noticed.
So I'm happy to see some questions populating the chat now, but I believe the first one, Erin, would you like to ask it out loud?
Sure. I'm just curious if any recent applicants over the last cycle were actually asked about your COVID experience during your interviews and how you responded to that. Challenges, what you did during it. Go ahead, Sandy.
Yeah. So actually, so during my application cycle, I got a job at Connecticut Children's, and I was actually doing COVID testing for the hospital. And I talked about that in my application. So one of my interviewers did ask me about it. And, I had to get trained on how to run the PCR machine. Well, how to do it with them and all that stuff. So it was an interesting conversation to have. They didn't necessarily ask me like how it impacted me personally, but there was for each of the schools, they had a section where they said if COVID affected you in some way personally with your, you can talk about it. And, they felt like they brought it up just because it was part of my like additional experience because it was work. But I had also written about how financially it impacted me and also with my MCATs because I took the shortened MCAT as well. So, and I had applied for the fee assistance. So if anybody wants to talk about that, but so you can yes you can talk about it, yes, because as long as it's in your application, it's fair game for you to bring up. Mm-hmm.
And I would expect that it will come up in some for the upcoming cycle, especially for students because they've been in, working and living in COVID maybe longer than some of you who interviewed a year ago. And so somebody asked, how do we go about answering what our COVID experiences was, and should we take advantage of this question? One thing we've been saying to students in our applicant coaching sessions is absolutely feel free to acknowledge some of the limitations or challenges you had have or are experiencing. Shadowing has been a big one for current applicants, not being able to do that, but then talk about what you have been doing instead in your community. Have you been engaging in service? Have you still been an EMT? Have you taken leadership of an organization during a really hard time? So yes, absolutely. If you are asked, be prepared to talk about what you've done during COVID. Krista, do you want to add anything to that?
Nope, you stole the words right out of my mouth. All right, next question. Did anyone here participate in an MMI? Oh, I see one nod. Okay, Adrian?
Yeah, I participated in two. One was at UMass, and then the other one was at NYU. I'm not sure if there was a particular question about it, but I can just talk about, the general experience. I remember standing in the hallway with all the other applicants, and I think some were more prepared for this format than others. Some, uh, I got nervous for the first one at UMass just because I hadn't rehearsed that format. And you notice yourself getting nervous, and you try and check yourself. So that was an experience. I found the MMIs. I had mixed feelings about them. On the one hand, if it went poorly, you're leaving really soon. No, no, not exactly. Like if if it basically a lot of the questions you can't really prepare for. There are prompts at them. They're organized in a very structured, specific way, and so the way I approached them was like the way I would approach, like a lab practical where you have different stations that are each timed. Like it's a different mindset to get into, and I don't yeah, like I said, I didn't rehearse them as much because they're, most of my interviews were not MMI format. Um, And I think maybe that's because I was applying MD PhD, but I'm not totally certain. I don't know how popular the MMI format is and sort of what admissions folks take from them.
Thank you, and I apologize. I should have clarified too. MMI stands for multiple mini interview. We did talk about them a little bit this morning. I think at last count, there's about 80 schools that are using them. So the majority of schools still do more of a traditional interviewing format, either one-on-one or in a group setting, but they are popular at certain schools. And so it's just a bunch of stations you go around. You're posed a question or usually a situational question, oftentimes with some kind of ethical, moral dilemma. And so there's no right or wrong answer per se, but the team is looking to see your thought process and how you would react in that situation in a very limited time frame. So you really do have to think on your feet.
And I might just add one thing I found peculiar about the format is that the proctor is not supposed to talk to you. And so they, at least when I was doing it, so say you finish your thought and there's 2 minutes left on the clock, you can sit in silence or you can, make something up. Not all of the interviewers in the MMI format, some were a bit more flexible with the rules and, enjoyed chatting and didn't stick strictly to the prompt. But I'd say that was only maybe the minority. It was kind of maybe the more senior folks who, had a little bit more standing at the school and felt more liberty to kind of, go off the cuff. But others were very by the book, and it was kind of odd. Sometimes I just sat there in silence. Sometimes I thought if I could think of something else. If there was a pause and I thought of something else, do I bring it up again? It was, I don't really know how important all these little small dilemmas are, but in the experience itself was a little bit odd. Yeah, I'm interested to think about what admins and admissions folks think about the format.
Did anyone else experience one or no? Okay, well, thank you for your candid remarks, Adrienne. I know that they do cause a lot of anxiety oftentimes, so that's very helpful. Our next question, I believe, in the queue is for our alumni who participated in migrant farm workers, the migrant farm worker clinics. Could you please talk a little bit about your experience, maybe how you connected that during your interviewing time as well, please?
Sure. Like I mentioned before, I was a Spanish translator for the clinics. I was present with the patient from the minute they stepped on to the clinic to the minute they were dispatched at the end, handed their medication and diagnosis. Like through registration, through waiting times and everything. I think that experience was really particularly helpful in like helping with just learning how to talk to people and learning how to connect with people. I think especially at these clinics, they only have a few med students or a few attendings on hand for many patients. Like I think one time we only had like 3 or 4 medical students and 1 attending, and there was over 20 or 25 patients waiting there. And so there are a lot of periods of like long waiting times, and you have to keep in mind these farm workers have already been out on the field for such a long time. Like the last thing that they want to do is wait like another hour or two to get checked up. Like they just want to go home and rest. So I remember just like learning how to become really chatty to get them to stay, and just keeping like them entertained, just talking about random stuff, like getting to know them, talking to them about like food or their culture or their family, anything to, make the waiting more bearable. So I think in terms of that, it was a lot of patient exposure. So if you happen to know Spanish, I think these clinics are such a great experience if you're willing to be a Spanish translator. But on the other end, I know there was also people who may not speak Spanish, but they would help with vitals. And I know that you still got patient interaction because not all of the workers were Spanish speaking. I think it was majority Spanish speaking and then majority farm workers from Jamaica. So, even if you can't speak Spanish, there are still other things you can do at the clinic. And I think it's still a very powerful experience for you to have.
Yeah, I totally agree. And I think these clinics for me it's just a really did change the trajectory of my life because I studied Spanish in high school and just never wanted to study it again. I thought I was really bad at languages. I never really liked Spanish in high school, but I started off at these clinics my freshman year of college as a just pre-med volunteer. So I was taking vitals and doing like taking blood pressure, but going to these clinics, I just realized that I really wanted to study abroad, and if I had the opportunity to learn a language that I've already studied in a different country, why would I go to somewhere like London where I already speak English if I had the chance to practice my Spanish and get better? So that going to those clinics made me change my study abroad to Spain. I studied abroad in Spain, one of the best things I ever did at UConn. And went back to the clinics as a translator, then as a coordinator, and wanted to improve my Spanish even more, and that's what led me to apply to a Fulbright year. And I picked Mexico because so many of the farm workers that I worked with through these clinics were from Mexico. And I actually ended up going to the same state that a lot of them are from, and was like an hour away from their hometowns. And the summer before I started med school, I went back to those clinics to work as a coordinator after having spent a year in Mexico. And I feel like it was just so full circle for me. I think that if you like languages in any way, just speaking another language in the medical field is such a plus. Not only is it an objectively good skill to have, but also the difference it makes when you're talking to a patient and they're in their own language is just so incredible. And it's something, if you've ever been a patient in a different country, you will feel that as well. Healthcare in the US is very divided, has a lot of disparities, and I think language is something that maybe you as a provider can do something personally to try and decrease it a little bit.
Those were such powerful remarks from both of you. Thank you so much. Some of you might know I'm a giant linguistics nerd, and so I'm just going to jump in with a really quick question because I do know as a fact that many of you, if not all of you on this call, do speak another language. Is anyone willing to share if any question about language skills came up in your interviews? Oh, Sandy, I think you're muted.
Oh, okay. Yeah. So they asked me about, so this was a long time ago, but when I used to live in Miami, I translated, we have a really high population of Haitians from Haiti in Miami. So we talk about that, and I used to translate into French and Haitian Creole as a volunteer and a translator for like the hospital that I worked in. Yeah. So we talked about that a little bit. And then they asked what was the population of, Haitians in Connecticut. And I was like, well, it's small. So, yeah.
In terms of languages, though, I think something to show that you really looked into the school and know it well is what population do they serve? And for me, when I would interview at schools where there were like schools in the Bronx in New York or Columbia University right next to Washington Heights with very large numbers of people that spoke Spanish, that was something that I would bring up my experience and why speaking Spanish in a medical setting is so important to me. And it just shows that you were aware of what is going on in the school, because the area and neighborhoods that they serve are pretty important to their mission as well, I've found.
Okay, so I believe our next question is, how do you navigate a group interview? What are they like? I suppose, are they daunting? Did you find it more comfortable than one-on-one? Any thoughts, please?
So I only had one group interview, and it was, I think just the dynamic of sitting is like a little bit odd, right? You're usually sitting one and then three people, and that it alone can be intimidating. But I didn't find it that way. Maybe in my case, it's a bit of a peculiarity because the third person, it was clear that they had gone in just before me and were leaving after me. So they were, I think, kind of a stand-in, and it's not easy for them to always have the same three people all day long. And so maybe you'll have the director of the program and maybe they'll rotate the other faculty. But they, the answers to my questions were the same. I just, had a conversation with three people instead. And, you make eye contact with each of them and you be conversational, even though that might, be difficult or, the dynamic might change, how you feel speaking. But altogether, it wasn't particularly challenging. I felt like it was just like the other ones. And almost in a way, it felt like you got more of your interviews finished for the day in one shot, even though wasn't actually true. It felt that way. But I found it not jarring at all, just the same as really the others. And I definitely liked it better than the MMI.
Michael, I don't want to put you on the spot. You're able to refuse, but do you mind sharing a little bit of the dental perspective?
Yeah, sure. Just like with the group interview aspect, or yeah. So one of the schools I interviewed at was a group interview, but it's kind of different because it was online, so that was kind of weird, like having like a group like Zoom call. But I guess with like any interview, you just like wait your turn, like try not to like speak over anyone and just be polite and just do your best, I guess. But yeah, definitely it's like different compared to just like a one-on-one interview because you can like sometimes feel like your focus is kind of drifting, but just try to just keep your head in the game and basically just um yeah, I guess.
Anyone else? Going once, going twice?
Yeah, I also had a group interview where it was like 6 pre-med students versus an interviewer. And we all left that interview and we were like, what was the point of that? I think group interviews are just to make sure that, you don't talk over other people, you have manners, you are a like normal human being. So it's interesting that we've all had different types of group interviews and different numbers of interviewers versus interviewees, but I think it's very much to make sure that you're like normal.
Actually, I would invite Dr. Sanford if he's willing to share a little bit of insider knowledge. Did you often conduct group interviews?
Yeah, I guess the comment I had, yes, we did. I think we were mainly after, individuals, comfort with collaboration and with support of others. We were on guard about folks who were too domineering, too quiet, so it was after how they would really, gel with other members of the class and how they would work together in groups to advance all of each of them and really support each other rather than be competitive. I think that was the main takeaway from our experience with group interviews.
Very helpful, thank you. I believe I do see one more question right now. It's more of a general question preparing. And so would anyone feel comfortable sharing how you found shadowing opportunities?
So I remember I believe I would ask around like some of my fellow like classmates who they've shadowed, who they might have enjoyed shadowing. And once I had established one connection with one doctor, I will like after shadowing that particular doctor, I would ask them, hey, like I'm interested in these other two specialties. Like, would you mind? Do you have any colleagues that would be willing to take on a pre-med student? And they would like connect me to another fellow colleague. And because it was like them asking their fellow colleague instead of me just cold emailing them, I was able to set up another quick shadowing opportunity. So I think it's like very much getting your foot in the door with at least like one physician. And then once you've got that one physician, they can easily connect you to a bunch of other physicians.
Okay, and just in the interest of time, going to keep moving on. So a really quick one, and then I think Tanya has a larger question. Did anyone write letters of interest intent a bit later in the cycle? And I will just preface this by saying that this does tend to be a school by school thing. So some schools do accept them. They're very happy to receive them. Other schools don't like to accept them. And so it can actually be more hurtful in a sense to send something if they're not looking for it. But I do see some people nodding. So anyone like to share if they did that at some point?
Yeah, so for Soma, I interviewed later into the cycle, and so after a month, I think, I wrote an like an intent letter saying, you know, if you guys accept me, I'll come here. I think one of the big things for me was that I would be away from my support system for a year, but because our program is that after my first year, I go to a community health center and I work and I'm a student there for 3 years, and so I was able to pick a center that's closer. That's in the East Coast. So I talked about that. I talked about how you know their mission is what I was looking forward to, and like being a DO is something that I wanted to do, having the whole person holistic view. So yeah, I made that very clear, and I told them, hey, like if you say yes to me, I'll say yes to you too. Yeah.
Okay, I suppose, Tanya, do you want to speak up and ask your question?
Yeah, I feel like this is obviously a huge question, but maybe just like a few key points, 2 to 3 bullet points of like maybe why you chose the particular path you did. So I know Catherine was saying she was deciding between MD and PA. We have an MD PhD in the room, DO, and DMD. Yeah, Michael talking about like the manual dexterity. So I just love to hear, yeah, like 2 to 3 like bullet point, like real quick, just like maybe like highlights or like what strengths does your career have? Like, oh, if somebody's really good with their hands, consider dentistry or like stuff like that.
I can go first. So my own pediatrician was a DO, and so I had experience from that. I had shadowed a DO when I was an AmeriCorps member at the federally qualified health center that I was at. My sister went to a DO school before me, so I had the experience of knowing what that means. And also, as a DO student, you get to work with your hands a lot, so you get to treat patients physically, and you get to learn a lot of techniques for manipulating the body and how that can improve someone's quality of life, or just to help them with any distress that they might be having physically. Um, so those are just reasons why I chose my path.
Catherine, do you mind sharing why MD and not PA?
Yeah, I feel bad though because there isn't a PA here to. I don't want to speak on behalf of all PAs, but so this is just my personal choice. PA school is 2.5 years, first year preclinical, second year clinical rotations, kind of like med school, except med school is 2 years preclinical and 2 years of clinical rotations. And the thing about PAs, as soon as you graduate, you start working and you can switch fields as many times as you want. In medicine, you do at minimum a 3-year to 7-year residency, and then after that you work in one specific field. And what drew me to PA school at first was that the schooling's shorter, there's less debt, there's more flexibility. I thought that, I don't even know what I want to eat for lunch most days. How can I pick one specialty for the rest of my life? That just seems like too much commitment, especially at the age of 21. But what ultimately made me decide med school was that I think my personality is just, I do love learning about one thing. And I think for me, I like having all the answers. And I think in ultimately MD, when you pick one specialty, you become an expert in that specialty, and you have the answers for people when they have something going on with their body that they don't know. And I just realized that's how I wanted to work in medicine. I wanted to be that physician who is able to like provide an answer when people don't know what's going on with their body. And I thought the best way for me to do that was to pursue medical school and get all those years of training. It's very long, it's very expensive, but I think for me, that was worth it. I think that's such a personal decision though, because some people would be like, no, that's crazy. Why would I do that? And maybe in that case, school is definitely the right choice for you. But I talked to a lot of PAs and I talked to a lot of people in med school before making my decision. So if you're thinking about the two, definitely try to reach out to everybody you can.
Thank you. Michael, do you mind sharing how you demonstrate manual dexterity on your application?
Yeah, sure. So in the application, there's like a section that they ask about it specifically. So I talked about how like I played like instruments like throughout school, and then like picking up like any hobbies like during COVID that like involve like using manual dexterity, just something to like strengthen the application, like talk about that. I guess with picking dental like over medical or any other profession, like from shadowing my general dentist, I love the hands-on aspect. Like as because it's like something like that's like always like in demand, that you could always work on people. And I guess the overall just like the lifestyle, like the ability to just be like your own boss, like owning your own practice was like something that I was looking forward to. So I guess that's one of the main reasons why I chose dental over anything else.
I do recognize we're running out of time very rapidly now. I do want to invite any staff members on the call to chime in with any comments, thoughts, final wrap up.
I just want to thank everybody for taking the time to be here today and for actually kind of paying it forward, it seems, for all the help you've gotten in your success stories. As we mentioned, Heather's going to be reaching out to our current med school students to try and do some one-on-one connections with students as they go through the interview process. So if you have a few minutes to engage in that over the next few months, please do respond to her survey. But thank you everybody for sharing, and for Krista in her always for her expertise in getting everybody together and putting together such an amazing panel, because Krista's amazing herself.
Okay, and thank you also for dropping a few more comments in the chat about how you arrange shadowing. So it sounds like a lot of people did just reach out to their own family doctors, pediatricians. Cold calling works sometimes, it doesn't work other times. So good places to start though. All right, and with that, I do want to thank everyone again so much for tuning in today. Your comments were so insightful and helpful, and I'm so glad that our current UConn applicants have the opportunity to hear your responses as well. All right, and thank you for those of you putting the contact info in there. So best wishes as everyone moves forward in